Good day, I am Richie Tricia Hidalgo, a student nurse from Davao Doctors College, and today I'll be performing a return demonstration of cardiopulmonary resuscitation, specifically for adults, which is done to revive an adult from cardiac or respiratory arrest. Now, first is to make sure that the scene is safe prior to approaching the patient. So the scene is safe. Next, check for help to assist you in doing CPR to the patient. Help! Help! This man is unconscious. Help! Help! And then check for the pulse and breathing simultaneously to determine if patient really needs CPR. Also check for level of consciousness and responsiveness. Sir, are you okay? Sir, can you hear me? And then, next is to activate emergency response system or to send for AED, so emergency responder will be aware and come for help if the patient doesn't have pulse or breathing. You, sir, in black shirt, call 911 immediately. Patient here is in need of help. And then for high quality compressions, place the heel of your dominant hand on lower half of sternum to effectively compress the heart and do 30 compressions in no less than 15 and no more than 18 seconds for perfusion of blood. And compress at least 2 inches to effectively pump blood throughout the body and complete recoil after each compression to allow blood flow to flow back to the heart. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Next is to give 2 breaths with a barrier device for personal protection, and each breath must be given over 1 second to minimize interruption. There must be visible chest rise with each breath to ensure there is air entering the lungs. Do the head tilt and chin lift. And then resume 30 compressions in less than 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And next is the for automated external defibrillator. First is to power on the AED for it to start. And then attach the pads correctly to deliver shock to correct sites and ensure that it is attached directly to the skin of the patient. So this one is on the upper right chest, below the collarbone, and this one is on to the lower left chest. And next, AED will tell you to clear for analysis to analyze the patient's heart rhythm accurately, then clear to safely deliver a shock without transmitting a shock to anyone who's touching the patient. Everybody, clear! Next, deliver a shock safely to help the heart return to its normal rhythm. Now, delivering a shock in 3, 2, 1. Next, switch rows after every 2 minutes or every 5 cycles to prevent fatigue and maintain high quality compressions. Then practice a good team dynamics for a higher chances of saving a life. Assuming that 5 cycles of compressions was done now. Now ready to switch. So next is the CPR specifically for a child. First is to make sure that the scene is safe prior to approaching the patient. So the scene is safe. Now check for responsiveness by tapping the shoulder. Hey, 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 are you okay? Hey, 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 are you okay? And then activate emergency response system. You mom in white shirt, call 911 immediately. We have patient here in need of help. And after that one is to open the airway and check for breathing for up to 10 seconds using the look, listen, and feel method. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. And then, if the client is not breathing, give 2 rescue breaths for 1 to 1.5 seconds each to supply oxygen. And then next is to check for signs of circulation to confirm if patient needs CPR. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. If there is no sign of circulation, proceed to CPR to revive the patient. Now, in doing CPR to children, first is to place the heel of one hand in correct position for chest compression to pump the heart. Then give 30 chest compressions in 1 to 1.5 inches deep at a rate of 100 compressions per minute to effectively help the heart pump blood throughout the body. Continue the 5 cycles of compressions and 2 rescue breaths per cycle to supply oxygen. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then, after doing the 5 cycles of 30 compressions and 2 rescue breaths, next, after 1 minute of CPR, pause and check the patient to check for signs of circulation to know if pulse and breathing is back. And then after that is to put the patient in recovery position to prevent aspiration and document the time that the procedure started and time of recovery for clinical communication. Next is cardiopulmonary resuscitation, specifically for infants. First is to assess for infants' response, no breathing or only gasping, at least 5 seconds but not more than 10 seconds to prevent delaying CPR if needed. Baby, baby, are you okay? Baby, baby. And then after that one is to send someone to activate emergency response system. So emergency responder will be aware and come for help. You, sir, in blue shirt, call 911 immediately. Patient here is in need of help. And then after that is to check for pulse in no more than 10 seconds to prevent delaying the CPR. Then give high quality CPR to help the heart pump blood. Start it by placing 2 fingers for compression, which is in midline below nipple line. Each set of compressions has to be delivered in 18 or below 18 seconds with at least 1/3 depth of the chest or 1 1/2 inches to effectively pump blood. Allow complete chest recoil for blood to flow back to heart. And minimize interruptions by giving 2 breaths in less than 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then in 2 rescuer CPR and switch, assuming that second rescuer arrived with bag mask device during 5th set, switch roles to prevent fatigue and maintain high quality CPR. Now, ready for switch roles. Next, continue the CPR with second rescuer. Assuming that I am now the second rescuer, give 15 compressions in 9 seconds or less for 2 cycles with thumb encircling hands technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then, assuming that I am the first responder, again deliver 2 breaths with bag mask for 2 cycles. 1, 2. And then, assuming again I am the second rescuer, 15 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then, assuming again that I am the first rescuer, 1, 2. After 2 cycles, switch roles again and resume high quality CPR. Assuming again now that I am the first rescuer, do 15 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now, assuming that I am the second rescuer, 1, 2. First rescuer, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And 1, 2. So next is cardiopulmonary resuscitation, specifically for a newborn. Start by evaluating newborn's transition to extrauterine life using the Apgar scoring to determine if immediate resuscitation is needed. Now, assuming that the newborn has an Apgar score of 3. And then next is to check for responsiveness by tapping the shoulder, rubbing the soles, and calling out the name loudly because we have to proceed to CPR if there is no response. Baby, baby, can you hear me? Baby, baby, please cry. Now, if there is no response, position the newborn on his back like this and call for help to activate the code blue or doctor squeak so that the doctor and nurses will come over to help. Next is to open the airway and suction if necessary to ensure an open passage for spontaneous breathing, assuming that I am suctioning the airway of the newborn. Now, if patient is apneic and bradycardic, initiate positive pressure ventilation or the PPV with pediatric valve mask for ventilation. Start by attaching the BVM to oxygen cylinder with 100% oxygen to supply to the newborn. And then cover the entire mouth and close with the BVM to ensure that the oxygen is received by the newborn. Allow 30 seconds of ventilation or 40 to 60 breaths per minute for lung aeration. And then look for chest rise with each bagging to ensure there is air entering the lungs. Breathe 2, 3, 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 2, 3, breathe 2, 3, breathe 2, 3, breathe 2, 3, breathe 2, 3. Breathe 2, 3, 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 breathe 2, 3. Now, after the 30 seconds, next have someone attach the cardiac monitor and pulse oximeter to check heart rate. Co-nurse, please attach the cardiac monitor and pulse oximeter. And then if heart rate is still less than 60 beats per minute after 30 seconds of PPV, do gentle chest compressions to help the heart pump blood. Now, do compressions with your 2 to 3 fingers or 2 thumb technique, then place compression fingers at this midline below the nipple line to compress the heart. And then press down the chest in approximately 1/3 depth or about 1.5 inches to effectively pump blood throughout the body. And then observe 3:1 compression to ventilation ratio, completing the 4 cycles in 2-man rescuer for high quality compression. Now, assuming I am the first rescuer doing the compression and this is the hand of the second rescuer giving breath for the newborn. 1, 2, 3, 1. 1, 2, 3, 2. 1, 2, 3, 3. 1, 2, 3, 4. Now, after the 4 cycles, evaluate the heart rate to know if it is already within normal range. If heart rate is still less than 60 breaths per minute, continue doing chest compressions and assist in intubation and giving medication to further help the newborn to breathe. But since the heart rate is more than 100 beats per minute, proceed in doing post-resuscitative care to stabilize the patient's condition, such as monitoring vital signs. But after that one is to put the patient on a recovery position. Like that. And lastly is to document the time, procedure, assessment, responses to treatment, and medications given to promote clinical communication.